Bismillahirrahmanirrahim. Quote of the day: Success is getting what you want, happiness is wanting what you get. Today, the topic of my presentation is cancer, and I'm presenting it under supervision of my professor, Dr. Saira Afzal. Learning outlines, global pattern, risk factors, prevention, screening, palliative care, breast cancer, lung cancer, colorectal cancer, recent updates, and MCQs in the end. Learning outcomes. In the end of presentation, participants would be able to describe the risk factors, screening, prevention of common types of cancer. Now, what is cancer? It is a disease in which someone of the body cell grow uncontrollably and spread to other parts of the body. Problem statement. New global cancer suggests that the global cancer burden has risen to 18 million cases and 9.6 million cancer deaths. The International Agency for Research on Cancer estimates that 1 in 5 men and 1 in 6 men worldwide will develop cancer over the course of their lifetime, and 1 in 8 men and 1 in 11 women will die from their disease. A number of factors appear to be driving this increase, particularly a growing and aging global population and increase in exposure to cancer risk factors linked to social and economic development. For rapidly growing economies, the data suggests a shift from poverty or infection related cancers to those associated with lifestyles more typical in industrialized countries. This is called westernization. Now, global cancer pattern. Cancer is the leading cause of death worldwide, accounting for nearly 10 million deaths in 2020, and the most common in 2020 cases, lung cases were first there was breast cancer, then lung, followed by colon and rectum, prostate, skin, and stomach. And the most common causes of cancer deaths in 2020 were lung, colon and rectum cancers, followed by liver, stomach, and breast. Now, this is the global map showing it is the representation of showing that the most common type of cancer incidence by GlobeCon 2020, and in this we can see that among males, prostate is the most incident of cancer worldwide, and among females, there is the increased incidence of breast cancer globally, followed by cervical and other cancers. And this is the map showing most common type of cancer deaths by GlobeCon 2020. And according to it, the most deaths caused by the cancer is lung cancer among males, followed by prostate and liver cancers. And among females, it is due to breast cancer and followed by cervical and lung cancers. So incident burden of major cases in Pakistan, and there is the highest incidence is of breast cancer, followed by lip oral cavity, lung cancer, and others. Risk factors. Mm, it includes biomedical factors, which include genetic susceptibility, for example, cancer of the breast, ovarian, bowel, and hormonal factors in females, lifestyle factors like smoking, alcohol consumption, physical inactivity, obesity, chronic infections, diet, environmental factors, which include sunlight, radiation, occupational exposure, and pollution. Primary prevention. It includes control of tobacco and alcohol consumption. It has been estimated that the control of tobacco smoking alone would reduce the total burden of cancer by over 1 million cancers each year. Personal hygiene. Improvements in personal hygiene may lead to decline in the incidence of certain types of cancer, for example, cancer of cervix. Radiation. Special efforts should be made to reduce the amount of radiation received by each individual to a minimum without reducing the benefits. Then comes occupational exposures. The occupational aspects of cancer are frequently neglected. Measures to protect workers from exposure to industrial carcinogens should be reinforced in industries. Then comes immunization. In case of primary liver cancer, immunization against hepatitis B virus, and for prevention of cancer, cervix immunization against human papilloma virus presents an exciting prospect. Food, drugs, and cosmetics, they should be tested for carcinogens. Air pollution, control of air pollution is another preventive measure. Treatment of precancerous lesions, that is early detection and prompt treatment of precancer lesions such as cervical tear, intestinal polyps, warts, chronic gastritis, chronic cervicitis. These are the one of the cornerstone of cancer prevention. Then comes legislation. It has a role in primary prevention, for example, legislation to control non-environmental carcinogens, for example, tobacco, alcohol. Then comes cancer education. An important area of primary prevention is cancer education. It should be directed at high-risk groups. The aim is to motivate people to seek early diagnosis and early treatment. Cancer organizations in many countries remind the public of the early warning signs, that is, danger signs of the cancer. These are lump or hard in the area in the breast, a change in a water mole, persistent change in digestive and bowel habits, persistent cough or hoarseness, excessive loss of blood at the monthly period, a loss of blood outside the usual dates, blood loss from any natural orifice, swelling or sore that does not get better, unexplained loss of weight. Then comes secondary prevention. Cancer registration, it includes hospital-based registries and population-based registries. The hospital-based registry includes all patients treated by a particular institution, whether inpatient or outpatients. Registries should collect the uniform minimum set of data recommended in the WHO handbook for standardized cancer registers. Population based registries. A right setup is to set up a hospital based cancer registry and extend the same to a population based cancer registry. And its aim is to cover the complete cancer situation in a given geographic area. The optimum size of base population for a population based cancer registry is in the range of 2 to 7 million. Then comes early detection of cases. Cancer screening is the main weapon for early detection at a pre-invasive or pre-malignant stage. Effective screening programs have been developed for cancer, breast cancer, and oral cancer. Then comes treatment. It includes hormone therapy, surgery, bone marrow transplantation, chemotherapy, targeted therapy, radiation therapy, immunotherapy, and the selection of these therapies depend on the type of the cancer. Then this is the CDC guidelines about cancer prevention among youth. The examples include promoting protective behaviors like completing the HPV vaccine series, eating a diet rich in fruits and vegetables, getting enough physical activity, ensuring safe, stable, nurturing relationships and environment, reducing harmful exposure like avoiding intentional tanning, quitting smoking, and avoiding exposure to certain chemicals and medical imaging procedures, and preventing adverse childhood experiences. Then comes cancer prevention during early adulthood includes promoting healthy behaviors like eating diet rich in fruits and vegetables, again getting a regular physical activity, healthy weight, using sun protection, breastfeeding, and avoiding tobacco products and secondhand smoke, avoiding intentional tanning, and limiting consumption of alcohol and sugar sweetened drinks. Then it includes cancer prevention during midlife. The examples include again maintaining physical activity, healthy weight, sleeping, and managing chronic diseases such as diabetes, testing for hepatitis C virus infection, getting help to quit smoking, screening for and managing obesity, screening for certain types of cancer, and again reducing harmful exposures. Then, what is screening of cancer? It may be defined as a search for unrecognized malignancy by means of rapidly applied tests. The U.S. Preventive Services Task Force and the American Cancer Society are two organizations that issue widely used cancer guidelines. Both use methods that comply with a National Academy of Medicine standards, and cancers for which screening is recommended for average risk population includes breast cancer, cervical cancer, prostate cancer. And cancer for which screening is recommended for high risk population includes colorectal cancer, lung cancer, liver cancer, and ovarian cancer. Now, there are two types of screening. Mass screening, it is the screening of a whole population or community irrespective of the risk, and it increases program sensitivity but less cost effective. High risk or selective screening, it is applied selectively to high risk groups, more cost effective but decreases program sensitivity. It has a high positive predictive value. Now, the screening, so EDC supports screening for breast, cervical, and colorectal lung cancer as recommended by USPSTF. Breast cancer mammograms are the best way to find breast cancer early when it is easier to treat. Colorectal cancer, it develops from precancerous polyps in the colon or rectum. Screening tests can find precancerous polyps so they can be removed before they return to cancer. Screening tests can find colorectal cancer early when treatment works best. Lung cancer. The USPSTF recommends yearly lung cancer screening with low dose CT for people who have a history of heavy smoking, smoke now or have quit within the past 15 years, and are between 50 and 80 years old. Cervical cancer. The PAP test can find abnormal cells in the cervix which may turn into cancer. It looks for the virus, that is human papilloma virus, that can cause these cell changes. PAP test can find cervical cancer early when the chance of being cured is very high. Now, palliative care. It is treatment to relieve rather than cure symptoms caused by cancer and to improve the quality of life of patients and their families. Palliative care can help people live more comfortably. It needed in places with a high proportion of patients in advanced stages of cancer where there is little chance of cure. Relief from physical, psychological, and spiritual problems through palliative care is possible for more than 90% of patients with advanced stages of cancer. And effective public health strategies comprising community and home based care are essential to provide pain relief and palliative care for patients and their families. The SIRA program, it stands for Surveillance, Epidemiology and End Results. It is the main program that the National Cancer Institute uses to support cancer surveillance activities. It is an authoritative source of information on cancer incidence and survival in US. It currently collects and publishes cancer incidence and survival data from population based cancer registries covering about 48% of the US population. It supports multiple types of research related to cancer by helping connect patients with clinical trials that evaluate the effectiveness of new treatments, supporting studies that work with patients to answer specific questions about their cancer care and outcomes, and supporting other types of epidemiologic studies. Cancer registries. Population based registries record all cases in a defined population with an emphasis on use of the data for epidemiology and public health purpose. These are designed to determine cancer patterns among various populations or subpopulations, to monitor cancer trends over time, guide planning and evaluation of cancer control efforts. Help prioritize health resource allocation, advance clinical epidemiologic and health services research, and cancer surveillance programs such as FEAR programs. It uses cancer statistics collected by population-based registries. Then comes hospital-based registry, maintain data on all patients diagnosed or treated for cancer at a particular healthcare facility. Its focus is on improving patient care at that hospital. Then comes special cancers registries, which collect and maintain data on a particular type of cancers. Then comes cost effectiveness analysis of a screening program. It is to determine whether a screening intervention is economically efficient. We compare its cost and effective effects with cost and effects of all alternatives, including doing nothing. Effects of intervention should be measured in quality adjusted life years gained. The cost included in cost-effective analysis of screening, it depends on screening test cost of diagnostic follow-up, cost of complication, cost of overdiagnosis and overtreatment, and savings from preventive treatment diseases. The components of quality adjusted life years gained with screening, it includes life years gained because of prevented cancer death, increase in quality of life because of less invasive disease and treatment, and decrease in quality of life because of screening, diagnostic follow-up, complications in treatment. Why incremental cost effectiveness analysis necessary? An example is like screening with the new test cost almost $7 lakh and gains 60 quality adjusted life years. And screening with the established test cost $100,000 and gains 80 quality adjusted life years. So therefore, it is very important to compare intervention to its alternatives. Now, breast cancer, it is the most commonly diagnosed cancer globally according to GlobeCon 2020, and it is the second most common cause of death caused by cancer after lung cancer. And October is the Breast Cancer Awareness Month, an annual campaign to increase awareness of the disease. These are the risk factors: non-modifiable, modifiable. Non-modifiable includes female gender, age, genetic changes, family history, personal history, race, ethnicity, and menstrual periods like early menarche, late menopause. Modifiable includes not having children, oral OCPs, Depo-Provera, hormone therapy after menopause, breastfeeding, alcohol consumption. Symptoms include swelling or lump in the breast, swelling in armpit, persistent breast tenderness or pain, nipple changes. And the breast cancer prevention includes limiting of alcohol, don't smoke, control your weight, be physically active, breastfeed, lose a limit dose and duration of hormone therapy, and avoid exposure to radiation and environmental pollution. Screening includes self-breast examination, clinical breast examination, mammography, breast ultrasonography, MRI, and positron emission mammography and mammogram. The American Cancer Society proposed this guideline that at the age of 40, women should have the opportunity to begin screening. And at the age of 45, she should begin yearly mammograms. And at age 55, transition to mammograms every other year at age 55 and continue with annual mammography. And after the age of 55, she should continue to have regular mammograms. So these are the five standard breast cancer treatment options. Local includes surgery, radiation, and the system includes hormone therapy, chemotherapy, targeted therapy. Then comes the second most common, that is lung cancer. It is the second most common cancer with incident rate of 11% worldwide, and it is the most common causes of cancer deaths in 2020. The risk factor includes smoking, passive smoking, some organic chemical, asbestos exposure, radiation, family history, air pollution, and chronic lung disease. Symptoms include hacking cough, loss of appetite, shortness of breath, bleeding, chest pain, right-sided abdominal pain, generalized weakness, lump in the neck, and weight loss. Prevention, it includes don't smoke, avoid passive smoking, stay away from radiation exposure, avoid exposure to asbestos and carcinogens, eat diet full of fruits and vegetables, exercise regularly. Screening. Lung cancer screening criteria is that the patient should be 55 to 77-year old, and he should be currently smoking or have quit in the last 15 years and have at least a 30 pack years history. Lung cancer diagnosis, it is done by history and physical examination, diagnostic test, chest x-ray, biopsy, staging test done usually by CT scan, bone marrow aspiration, and PET scan. General management of lung cancer. It includes surgery, which could be wedge resection, segmentectomy, lobectomy, bilobectomy, respiratory care treatment protocols, chemotherapy, radiation therapy, and comfort care. Then comes colorectal cancer. The incidence of cancer, colorectal cancer in 2020 was 10%, and however, the deaths caused by the colorectal cancer in 2020 were 9.4%. The symptoms include fatigue, persistent bowel discomfort, rectal bleed or blood in the stool, change in bowel habits, and explained weight loss. Screening is done through colonoscopy, virtual colonoscopy, sigmoidoscopy, and take-home stool testing, blood test. And prevention can be done by staying active, reducing or limiting red and processed meat, maintaining a healthy diet, stop smoking. And usually, almost half of the colorectal cancers can be prevented by all of the strategies like maintaining healthy weight and move more in any or every day, fill up or fiber rich foods, limit red meat, and stop drinking alcohol. Colorectal cancer prevention nutrition. It suggests that our plate should consist of two-third or more vegetables, fruits, whole grains and beans, and one-third of it or less than this should consist of animal protein. So this plate is called New American plate. Yes. And now moving on to recent updates. The key effects on cancer proposed by WHO that about a one-third of deaths from cancer are due to tobacco use, high BMI, alcohol use, low fruits and vegetables intake, lack of physical activity, cancer-causing infections such as HPV, and are responsible for about 30% of cancer cases in low and middle-income countries. And late-stage presentation, lack of access to diagnosis and treatment are common, particularly in low and middle-income countries. The economic impact of cancer is significant increasing, and the total annual economic cost of cancer in 2010 were estimated to be $1.16 trillion. Now, this is an article titled as Chemo Prevention of Breast Cancer with Vitamins and Micronutrients. There is sufficient evidence from in vitro animal epidemiologic human studies that certain vitamins such as vitamin D3, folate, vitamin B6, beta carotene, as well as dietary micronutrients such as curcumin, piperine, and omega-3 polyunsaturated fatty acids display anti-tumoral activity against breast cancer and have the potential to offer a natural strategy for breast cancer chemo prevention and reduce the risk of breast cancer recurrence. This is another article insight into the roles of vitamin C and D against cancer, myth or true. The epidemiology studies document that vitamin C and D possess potential anti-neoplastic property, and vitamin C at pharmacological concentration has cancer selective cytotoxicity in several cancer cell lines. Moreover, the cognition of vitamin D has become hormone D, which modulates a variety of molecular targets and signaling pathways, contributing to the inhibition of cancer. Now, multiple choice questions. MCQ number 1. Colorectal cancer is the second most common cause of death caused by cancer. Almost half of the colorectal cancer is prevented by all of the following except limit red meat and healthy food, maintain healthy diet, healthy weight, avoid alcohol and smoking, adequate rest, intake of fiber diet. Any guess? So all of almost half of the colorectal cancer can be prevented by all of the following, except so it is option D, that is adequate rest. MCQ number 2. A 55-year-old female comes to OPD with complaint of right breast lump and nipple discharge and you are suspecting breast cancer. Which of the following is most sensitive and specific screening test to detect breast cancer? FNAC, mammography, breast self-examination, CT scan, MRI.
B,
A.
mammography.
Yes, B is the right option. Yes. MCQ number 3. To determine whether screening intervention is economically efficient, we compare its cost and effects with cost and effects of all alternatives, including doing nothing. Effects of interventions should be measured in quality adjusted life years gained, disability adjusted life years, health adjusted life years, hospitalization days.
C.
A,
Yes, A is the right option. MCQ number 4. A 45-year-old female having strong history of breast cancer taking Depo-Provera injection IM for last 5 years visits her family physician for routine medical checkup. According to the new guidelines, at what age she should get mammography done yearly as high-risk patient? 35, 45, 40, 30, 20.
30. D.
30.
No, it is C.
D.
45 is the right option. MCQ number 5. Cancer screening is defined as a search for unrecognized malignancy by means of rapidly applied test. Which of the following is not the criteria for lung cancer screening? Age 55 to 77 years, passive or second-hand smoker for last 10 years, currently smoking, completed 30 pack years.
B.
Yes, B is the right option. MCQ number 6. A 60-year-old man came to surgical order with complaints of recurrent diarrhea with rectal bleeding and sudden weight loss. You are suspecting colorectal carcinoma. What would you suggest for him? Colonoscopy, PET scan, CT abdomen, ultrasound, abdomen, MRI.
A.
A.
Yes, A is the right option. MCQ number 7. Female breast cancer is the most commonly diagnosed cancer globally. There should be awareness campaigns on risk factors and screening of high risk groups. Which of the following is non modifiable risk factor of breast cancer? Asian females, chest radiation, breastfeeding, late menopause, alcohol consumption. It's A. It is a non modifiable risk factor, race and ethnicity. MCQ number 8. Early detection and prompt treatment of precancerous lesions such as intestinal polyps, warts, chronic gastritis, one of the cornerstone of colon and gastric cancer prevention. What is this level of prevention? Primordial, primary, secondary, tertiary.
B.
Yes, right. MCQ number 9. Colorectal cancer is the third most common cancer worldwide. Which of the following factor reduces the risk of colorectal cancer? Vitamin C, dietary fiber, red meat, estrogen, caffeine.
B.
Yes, B
Dietary
is the
fiber.
right up. Yes. MCQ number 10. Cervical cancer is the fourth most common cancer in women worldwide. Which of the following is considered a main risk factor and necessary cause of cervical cancer? Human herpes virus, human papilloma virus, Epstein-Barr virus, rotavirus, C, human immunodeficiency virus.
B.
Yes, B is the right option. This is the key. This is the YouTube link of this presentation. And thank you.
Thank you very much, Dr. Meha. Very nice presentation, and especially the two things that I must emphasize that you have already presented in your slides are number first, the cancer registry system. We still know that cancer registry systems should be very specific for each and every cancer, and there should be journal cancer registry system that can be applied all over the province and over national level. Internationally, there are many cancer registry systems that are very effectively being used for proper treatment, follow-ups, compliance, and developing the systems for more resource allocation, cost-benefit analysis, and other important things. So we are always looking forward to have a cancer registry system in Pakistan. Second important thing that is present was about palliative care. Palliative care is when cancer has some metastasis or in the stage that is declared incurable by the medical management or the surgical or radiotherapy management. Still, they need care, and that is for the improvement of the quality of life, decreasing the complications, improving the pain, etc. So we also need certain palliative care centers that should be available at each and every district, tehsils, even at the national and provincial levels. However, we have seen that palliative care center in pediatrics in the Mayo Hospital it is present, but in rest of the wards it is totally deficient, not only in Lahore but also in the whole of the Punjab. If we count the total palliative centers that are present, they are so numerous that they can't cater the population that is so enormous. And for the people of Pakistan, more palliative centers has to be established. Another important thing is about screening. As in epidemiology, we have covered the basic principles of screening. So in cancer, screening is very important. It is not only the mass screening, but also the high risk screening and the highly selective screening that can play a pivotal role in prevention of cancer, early detection, early treatment, rehabilitation, and decreasing all the financial losses over the years. It would be the great step towards increasing the quality of life and also to increase the rehabilitative efforts and disability limitations. So both the Dallas, Gallis, Suleiman Index and other important indices have shown that the chronic disease is the most important part is still the increasing prevalence of cancer. More research is required why the cancers are increasing day by day and why the different cancers that have not been present in that community previously has reappeared or has increased or has appeared for the first time. All the three important notions has to be researched on that these cancers are having more prevalence than before, and there is no doubt about it. There are certain other cancers that have never been seen in certain communities, and they are appearing. Perhaps it is due to the diet or the lifestyle, or due to the chemicals that are being released, or air pollution, water pollution, and other harmful chemicals that have been released. However, more research is required in these important areas. I would like one of my students to do research on these important aspects, how to improve the palliative care for cancer patients, how to do more screening in some of the areas where the cancer is very prevalent and in those areas where new cancers are emerging. And the third important thing is about the registry systems, that how the registries they can help in decreasing the all the cost that is being super added while there are less systems and registries are present. So these are my few additions in this presentation. Very well done, very good presentation, and especially the MCQ part that was very uh, thoughtful. And it is very simple. Yes, it is simple too, easy, but it is thoughtful. Thank you. Allah Hafiz.
Thank you so much, ma'am. Okay, Allah Hafiz.